Hi, everybody, and welcome to the podcast series on innovative healthcare solutions sponsored by the Conference of Consulting Actuaries. As in the past, my name is Ed Pudlowski. I'm president of Morningstar Actuarial Consulting, and I'm also the chair of the healthcare community with the CCA, and I'm going to be your host for today's discussions. Now, just as a reminder, these podcasts are a series of interviews with actuaries and other professionals focused on delivering innovation in healthcare. These sessions are offered to provide insights about what's transpiring in our ever-changing healthcare environment in which we live in. I'm sure you're going to enjoy this session and all the great sessions we've had to date and plan to have coming up. These highlight the interesting people, products, and services designed to drive a better healthcare system. So with that, today, I'm really delighted to be joined by David Michel. David is CEO and founder of Catapult Health. He's also an entrepreneur and business executive that has started several successful companies in various industries, including healthcare, technology, and entertainment. We'll talk a little bit about that at the end of our podcast. So, David, thanks for joining us today.
Well, it's a pleasure to be here, Ed. Thank you for having me, and thank you for the good work that you do.
Thanks. So, David, for benefit of our members and audience watching this, why don't you give a little description of Catapult Health in case they're not familiar?
Sure. So Catapult Health exists really for one reason. We believe the delivery of basic care, primary care, preventive care in America is broken. It takes too long, it costs too much, it's too inefficient, all sorts of issues there. And so about 10 years ago, we started the company to reimagine and reinvent the way that basic care could be delivered. And we did that for the first 8 or 9 years at work sites. But 2.5 years ago, we took advantage of the misfortune that was presented to us in the form of a pandemic. And we transitioned our solution to be able to offer something 100% virtual. So today, we offer that annual preventive checkup that all of us are supposed to get, but only about 20% of Americans do, interestingly. So even though it's a part of all of our benefit plans, no deductible, no copay with the Affordable Care Act, 80% of us don't get it done. And that's of insured Americans. If you took all Americans, it's more than that. Well, we have taken that experience, that annual wellness checkup, that annual preventive checkup, and we deliver that more powerfully, more easily, and more conveniently than anyone else on planet Earth. And that's getting quite a bit of traction these days, as you can imagine. So we're very proud of that.
There's a lot of digital solutions out there, certainly focused on various aspects of the healthcare system. So I think there's a lot of people who agree with you that it's too costly, too complex, and too inefficient. So what made you focus in this particular area? Was there anything that kind of drove that decision?
Yes, so we're focused on what we call modifiable risk factors. And our goal is to move the needle in healthcare. And by move the needle, I mean to make things more efficient and more effective and to help people to find things earlier. And by focusing on modifiable risk factors, things that we can do something about, we really have that opportunity. So the kinds of things we focus on with our solution are the metabolic risk factors. So diabetes, right? The pre-diabetes and diabetes, hypertension. It's one of those risk factors that so many people are walking around with, have no idea, and yet it's such a significant risk factor. Cholesterol disorders, so heart disease disorders. We also, 3 or 4 years ago, took a dive into the deep end of the pool with respect to depression. And we assess everyone for depression using the PHQ. We just added anxiety screening. And so all these things are things that are modifiable risk factors, either by going to your doctor and getting a diagnosis and taking medication, or making a lifestyle adjustment, or all the above. And so that's where we focus. We do that annual wellness exam where we can help you to identify, what are my risks? What do I need to do about it? And then we connect you into that next point of care to be able to produce those evidence-based outcomes, which is what everyone's looking for.
Yeah. So talk a little bit about how that increases compliance with the annual preventative wellness checkup.
Well, if you think about, just everyone on your listening to your podcast today, I would invite everyone to just think for just a moment about when your last annual wellness exam was. And if I saw a show of hands, probably 50, 60, 70, 80% of you would say it's been more than a year. And why is that, right? Well, gosh, we're not feeling bad. We don't think we really need to go to the doctor, so we just kind of don't. Plus, it's so inconvenient. By the time you make an appointment 2-3 months out, and then you have to go to the lab separately, there's just a lot going on there. So what we do is we have developed a home kit. And in fact, I've got one right here. I'll just grab and show you here, Ed. So it's easier to show and tell. So we've developed this home kit, and you can see all these happy faces on it. And it says, no wonder these folks are smiling. They feel better today because they're healthier because of what's inside this box. Inside this box, it lands on your doorstep, and we provide a way for you to collect a very small sample of blood using a very innovative device. This is called a TASO device. And so, gosh, how many of us have done finger sticks in the past? Well, bye-bye finger stick. So this is a device you literally peel off the back and stick it to your arm without a shirt sleeve, obviously, press a button, and 3 minutes later, you have about 400 microliters of blood, and it's painless. It's virtually painless. So we send this home kit to your home. You send us a small sample of blood. We also send you a blood pressure monitor so you can measure it for us, but also on an ongoing basis. We get these things in, and then we combine that with all the other data that we collect, your filled prescriptions and so on, and take you through a virtual video consultation with one of our clinicians. And it's just powerful. I mean, it's compared to the process of having to do all of those things in advance to sign up and drive across town and take a half day off work and so on. Compare that to receiving this kit, sending a very small sample back, takes about 10 minutes to extract the sample. And then 3 or 4 days later, you're invited to schedule a virtual consultation on your phone, on your iPad, on your tablet. It may be on Saturday morning, maybe Sunday afternoon. We have appointments available all times of the day, typically available within 1 to 3 days of when we have your results ready. So it's a whole different way of doing healthcare. We're trying to delight you. We're trying to take an experience that for many is one of the most frustrating experiences that we go through each year, and making it one of the best experiences. That's really our goal.
So I guess what you're saying is many of the audience members watching this don't have a spouse like mine who makes sure that she has me going and getting my annual physical every year, huh?
That's exactly right. And again, we get busy, and if you're not feeling bad, if you don't have a reason you need to go, but in America, that's a real problem because you have so many people walking around with undiagnosed risk. Ed, the number of people we find every day, we've already seen 800 or 900 patients today, and it's only it's still early. The number of people we've already found today who had completely unknown and undiagnosed, severe hypertension, and completely unknown and undiagnosed diabetes. I mean, people with an A1C of 9.5, 10, 10.5, 11, people that are severely depressed and need help that just have not been to a provider. We are going into the corners for our clients and finding these people and inviting them to participate in this virtual experience that's very powerful.
So I would assume then too that as a result of being able to do a lot of this at home, send this information, collect it digitally, the ease at which you kind of make this process probably then also provides greater engagement with the member's primary care physician. Is that an accurate statement? Great
question, Ed. So our goal is to make sure everyone gets that annual preventive checkup, but we're not providing the ongoing care. Mm-hmm. So what do we do with the data that we find, all the blood work data and the physical measurements that you haven't gotten in quite some time? Well, the first thing we do is we say, do you have a primary care physician? And if you have one, we associate that doctor with your record in our system, and we zip up your results and send those results securely to your doctor right after the consult's done. So we do that. But if you don't have a doctor, we make the case why everyone needs a local PCP, and then we help you to find one during the consult with you. And so our whole goal is to be a great connector. We're gathering this actionable data that is very powerful, that's very actionable, and we're sharing it with the patient, with the member, We're also sharing it with their doctor. If they don't have a doctor, we're helping them to find a doctor. And then we're also plugging that member into all the programs that their companies have available to them that most of them know nothing about, right?
Interesting.
We all get our benefits package with all these different benefits, and
Right.
goodness, I mean, I don't take the time to read that when it's handed out at open enrollment, but sometimes you need those things, and they're very beneficial. So our job is to connect you, with the care provider and the care plan that's going to best help you to lower your risk factors before they present as a catastrophic event or a major claim.
I could see a solution like this also being a great assistance with the underserved population, right? Those who may live far enough away from a provider or may not have the income resources that allow them to get to the provider as often, their primary care physician as often as they like. Do you have any results around that you can share?
We sure do. In fact, many of our clients we have so many city of, county of, state government clients, for example, with people in every nook and cranny of the county or the state. We're just, working with the Department of Criminal Justice. We're working with people that are behind security. They can't get off to go to the doctor. We're working with people that are, one of our large new clients, I guess I can say this out loud, Lowe's Home Improvement. So Lowe's Home Improvement, if you think about a worker at Lowe's, both their full-time and part-time employees, these folks are hourly workers. They live in, out of the way places, and they're typically not getting care anywhere. So what we're doing for them and taking them through this annual wellness assessment and doing this risk assessment and doing this kind of a treatment plan, an action plan for them, and connecting them into care. Sometimes it's the first care they've gotten in years. And these people are in very healthcare deserts, as it were.
Right.
Many of them. We're working with a client in New Mexico. Imagine how hard it is to find a care provider in the outskirts of New Mexico. It doesn't get much harder than that.
Yeah.
So they've been looking for a solution, which we're providing now, to be able to serve everyone, no matter where they are. I mean, if they get mail and UPS, we can serve them.
Great. Well, these days I know employers are focused on obviously improving the quality of care that they can provide to their employees and their families. But they're also focused on, how this can potentially impact their cost if they're going to
Sure.
contract with a third-party provider. Can you talk a little bit about some of those results? I know you've done some studies, so I'm sure you've got some things you can share with our audience.
We sure have. So historically, we've tracked the clinical improvements year over year of the same group of patients. So we've proven over time that if someone comes to us and they're severely hypertensive, the intervention that we recommend for them, and then we track them the next year and the next year and the next year, we've shown how that hypertension goes down. And of course, there are actuarial results, associated with each of those kinds of activities. We just contracted with an actuarial firm earlier this year, or actually about a year ago now, to look at patient records from about 450,000 recent patients. And they took just 2 or 3 risk factors. It was just, heart disease, and I think diabetes, and then flu shot compliance. And even just looking at a very limited number of conditions, there was better than a 2-to-1 ROI for what the plan or the employer is spending to get this annual wellness checkup done, and the return it's bringing. And so really, it's not no one argues with the value of getting an
Right.
annual wellness checkup, right? I mean, the worst thing is you don't get one, and then something happens that's catastrophic later. So
Right.
so we fortunately, I always, in business, you want to be one of those businesses that's a got to have, not a nice to have. And Catapult is a got to have. I mean, you have to figure out a way to get your people to get their basic care, to get their risks assessed, and get plugged into care before it's too late.
Right. Now, how do you charge for your product?
We're set up as a medical provider. So we're a national preventive care medical practice. And so we bill preventive care claims for what we do. So we're partnered, example, nationally with Blue Cross and Blue Shield. So any employer, large employer, small employer that has Blue Cross and Blue Shield, they bring us in. They offer or promote our virtual checkup to their members. And then we provide our service, and we bill a preventive care claim through the health plan. So It's very simple. We've tried to the last thing healthcare needs is another disconnected piece. So everything we do is try to connect people. And the last thing healthcare needs is something just makes it harder. So everything we do is all about, we're using technology to make things very simple for the member. So one thing, I'll just share an anecdote with you. So when we were building our technology, you know how many of us have used virtual platforms, right? But what's the most frustrating experience? You go to use it and it's like, oh, geez, what was that password? What's the username? Where's the link? What do I do? I mean, and you can't get in. Well, our system, we developed in a way that it's high trust certified. So the highest level of service and of security, and yet there's no username, no password, no software download, and no app. You get a magic link, you click on the link and it just works. And that's game changing. So that means someone that's in their 70s, that's going through a Medicare Advantage annual wellness visit, which is something else that we do. They don't have to know how to do anything. They just have to have a phone. They get the link, they click on it, and it just works. And so, we're trying to really break it down and make it simple for people. There's enough in life that's complex. Let's make this simple.
Good. Well, it's nice to know there's not a kind of an additional add-on fee here for employers, since it's funneling right through the claims information, and that makes it easier for them too as well to kind of look to see, how that's progressing through their claims costs. So I appreciate that. So you talked earlier about the fact that COVID-19 kind of presented you with an opportunity, but did that change? And how did that change the way that you did business? That either was temporary during that period or something that you'll continue on post.
Well, it's interesting. So before COVID, 100% of our work required us to go on site to a location to do lab work and physical measurements, and then we would do the consult with a practitioner virtually.
Right.
When COVID settled in and everyone went home, that was a real problem. So we used that as an opportunity to come up with our home kit version, which I've shown you just a few moments ago. Last year, our business was about 50% on site and about 50% home kit.
Okay.
This year, my guess is it'll be 75 to 80% home kit and 20-25% on site. It's not that the on site's getting smaller, is that the home kit version is just exponentially growing. This is what people are looking for. They want to do things on their own time. Think about it. Where would you rather have a consultation with a clinician? Would you rather have it when you're sitting on your living room sofa or at your kitchen table on your own device, where it's private, where you have plenty of time? What we hear from or would you rather go to a doctor's office and do all that's surrounded with that? Well, what we hear from our patients is, gosh, I want to do this at home. I want to sit on my back patio. And what we hear from our clinicians is really interesting. People go deep quickly. When you are on a video call with a clinician and they look you in the eye and they say, Ed, how are things going? I see that we've asked you some questions about how you're feeling and it looks like you're struggling. Tell me how things go. Boy, they just go deep quickly. So that happens much more frequently now that we're having consultations with people in their own safe home environment than historically when they were at work, maybe in a conference room in the corner or something, because they're always wondering who's listening and is Big Brother really kind of monitoring the technology. They're not, of course, but you always feel that. So no, it's not only here to stay, but it is clearly our growth engine at Catapult is the virtual checkup, which is 100% virtual and remote.
Well, it's certainly where most of the rest of the economy is going today, right? With Uber Eats and my ability to order directly from the grocery store and get things delivered and everything. So you're certainly a trendsetter there, being ahead of the time. Well, David, I really appreciate you being here today. I tell you, at the end of these sessions, I usually like to go in and ask something kind of a little bit more of a personal nature. But you and I, as we've talked before, we met 20 years ago when you were starting one of your other businesses, Winning Habits. And when I walked into your office, I immediately recognized one of the toy models that you had on your floor of JJ the jet plane. So there are probably many in our audience who either had kids like mine back in the late 90s, early 2000s that remember JJ the jet plane. But I'm willing to bet too that there's quite a number of them now who are in their late 20s and early 30s who are watching that also remember that. Could you give us a little background on kind of the idea of creating that and how you went all about that? I think our audience would love to hear that.
Well, Ed, I'm kind of an odd duck. My degrees in college are in chemistry, geology, and divinity. I've started and grown 4 businesses. The first one was the one you've referenced there, JJ the jet plane. My son was 2.5. His name was John. His nickname was JJ. And I was returning home from all my travels on healthcare consulting, telling him stories. And so that led into, I've got a little model of it here for those that don't. So there's JJ right there, a little airplane with a face. So yeah, my wife and I actually co-created this show, and it aired on PBS for 10 years from 2001 to 2011. And so we had about 1 million kids a day watching.
Wow.
And it was very gratifying because the whole goal was to build positive, nonviolent role models for young kids. And Ed, in life, it's interesting how things become very clear when you get clear about your purpose in life. And for me, I've done some purpose work over the years, and my purpose is to lead and create for the greater good. So I'm in the strike zone. When I'm leading and creating for the greater good, I'm in my element. Well, you can see JJ was leading and creating for the greater good. This is a positive role models for young kids, nonviolent, and so on. Catapult, the virtual checkup. It's leading, it's for the greater good, right? There's some purpose and meaning behind it. So while some people look at me and think, what's wrong with you? You do a kids TV show and you do a healthcare company. In my brain, they're tightly connected. We're using technology in both cases to make things very simple. And we're bringing innovation to people that really need it. And I mean, there's an urgency about this because people are not getting their preventive care, and that's a real problem in America. So we find ourselves in a category of one. I mean, there's no one else that I'm aware of anywhere in the country that's doing this annual wellness visit virtually in the way that we're doing it. So we're very, very grateful. We're very blessed to be able to, love what you do and love the people you work with and just do a lot of good. So I'm a happy camper.
Well, I love ending on that motto, leading for the greater good. So for our audience, I'd like to encourage all of you to participate in our healthcare community and continue discussions about some of the insights that were shared here, doing that on that platform. And if you're not a member of the CCA and you're watching this, you might want to consider joining, not only to experience the benefits of the healthcare community platform that I mentioned in those informal discussions, but all the great benefits that our other members enjoy. David, it was a real pleasure having you here today, and really appreciated you sharing your insights and experience about Catapult and what you're doing to innovate in healthcare. I'm sure our audience benefited from time you spent with us today, and I know I sure did. So thanks again.
It's my pleasure, Ed. Again, thank you so much. Hope you have a great rest of your day.
Thanks, you too.